So I have known Dr. Watkins for, I guess, over 2 years now, that we've worked together in the DMSC, and she is a delight. She is consistently one of our faculty favorites. I hear from students all the time. Hey, Elise, welcome.
Hey.
About how wonderful she is, and she is quite the accomplished PA. She is well published. You've probably seen her articles in JAPA, and she was recently named the women's editor for Women's Health in JAPA. She is also president-elect of NCAPA. And with her background in art and anthropology, she is an incredible artist. Her artwork has been featured at at Florida State University's College of Medicine in their journal. It was the cover art for that, as well as other places. Elise, welcome. Thanks for being with us tonight.
Thanks for having me.
Yes. So Dr. Watkins helped develop our global health certificate, and she also teaches the global health course as well as some other courses in the DMSC. So we're going to talk tonight about the Doctor of Medical Science degree, as well as some of the certificates we offer. So the full DMSC program is 100% online. It does take 12 months. That's 4 12-week terms with a week break in between each term. The program options are to do the clinical track, which we do have administrators do as well. So even if you're not seeing patients, but you're working in a clinical, working in an administrative setting, there's an option for you for that. And we also have an education track. We are also very proud that we have offered several new certificates. We have a global health certificate, which Dr. Watkins wrote and developed the courses for, and she's going to be telling us more about that tonight. There's the medical education certificate, executive leadership, public health, epidemiology, emergency and disaster medicine, telehealth, and healthcare administration and management. And did I miss anything, Elise?
Sounds good.
Okay, well, Dr. Watkins, can you tell us a little bit, from a PA's perspective, why would somebody even think about doing the DMSC or a DMSC certificate?
And that's really the $1 million question. If any of you on this call are following the AAPA huddle, usually it seems like once a week there's some kind of controversy over a doctoral degree, and do we need it, and what are we doing? Are we going to price ourselves out of the market? Well, this is what I have to say about that. And I actually said this when I was in Washington, D.C. at the Leadership and Advocacy Summit for AAPA, when somebody from a different state got up and kind of dissed this whole idea of doctoral degrees. Well, number one, when you were doing your master's program or even your bachelor's, the credit hours that you've already done far exceed a master's degree. I mean, there are master's degrees out there, you guys, that are like 45 credit hours. Most PA programs are over 100. So the basic feeling is you should get credit for what you've already done. So this is kind of the bridge to do that. The other thing is we should be on parity with everyone else in the healthcare system. Right now, we're the only ones that don't have that doctorate. So you might say, well, that's just stupid degree creep. It's not. It's keeping ourselves relevant and competitive. And I do think it's incredibly important to do that. So I actually don't have a DMSC. I have a DHS. And the difference is that the DMSC didn't exist when I got my doctorate. If I were doing it now, I would choose the DMSC and I would choose this program. And the reason is it was the first of its kind. And so the idea behind this was born from a true passion for this profession and for advancing our profession. Dr. Welsh has chosen incredible faculty who kind of lead the way and have their little areas of expertise. It's 100% online. The idea is that we know that you're all working either clinically, in an outpatient setting, in an academic medical center, in a hospital. I see Dawn works at a health department. I mean, you guys have busy lives, and we understand that. Even if you're in PA education, I mean, we know that when you transition to PA education, it's actually more work than working clinically. But we understand that you have life experiences that you could bring to the classroom, but you also have those commitments outside of the classroom, and we understand that. So it's completely online, unlike other programs where you might have to go down and physically sit in a classroom for an entire week. That's just not practical. The other thing is we don't require original research. That's why we could do this in 1 year. And so some people have said, well, I don't understand how you can do a doctoral program in 1 year. Well, again, we're bridging that gap from master's to doctoral with all those credit hours. And we don't require original research, which can take 2 to 3 years to get that done. But you will do a doctoral project, which is essentially writing an article that could be published in JAP or any other peer-reviewed medical journal. Everything that you learn in our classes, each week, the intent is that you can take something back to whatever area of medicine you're practicing in. So if you're a PA educator, you're going to learn something every single week that is going to be relevant to what you do. If you're a clinician, in every single class, you're going to learn something that will be like, ding, ding, ding. How come I didn't learn that in PA school? Or I wish I would have known that before. So it's very relevant. It's not a bunch of esoteric information we're throwing at you just so we can have this whole degree creep issue. And then finally,
just real quick, that is one of the things that I've heard of your class, especially right now with the pandemic, is I talk to students all the time who are like, global health helped me understand exactly what was going on and what needed to be done. So
good. Thanks for that feedback.
Of course.
That's great. And then, no, that's okay. And then finally, I'm just going to throw out there that we are not the only program anymore. I mean, we have been for 2.5 years, but now so many other PA programs are kind of like on the train with us. And so we're seeing all these new programs develop. So this is going to be the future. And we had this really robust discussion earlier this week at our faculty meeting. Of course, we're doing this all virtually. And we talked about this issue. And so, the consensus is probably in the next 5 years, this is going to be the expectation. Will it be the entry level expectation? It probably will be. So for those of you who are kind of thinking about it, I would say, I think you're being forward thinking and you're going to get on the train because really it left the station. So you got to run and catch up to it.
Thank you so much for that. So I'm just going to go over a little bit about our admissions process and who is a candidate for the DMSC or the certificate. So if you're interested in one or the other, the admissions criteria is the same. And what I want to say is it's a very different application process than applying for a PA school. There's no CASPA, there's no interview day. We're very upfront with our admissions criteria. And we do our reaching capacity for our cohorts, but if there's capacity, and you meet the criteria, we're very upfront with that. And there's always, could be some oddball thing, but for the most part, we do have to accept PAs who have earned a master's degree or higher. Now, the master's degree does not have to be a master's of PA studies. It can be, a master's of public health. It is absolutely fine to have a different master's degree, but you do have to have a master's degree to enter this program. And you do have to have a 3.0 cumulative GPA from that master's degree. And you have to be a licensed, either NCCPA certified or have your state certification. And then we do have a fellowship requirement that aligns with your work environment. So you need to be practicing clinically, administratively, or in an educational setting. So that is the criteria. We ask for transcripts, all of that documentation to back that up. But that is what it looks like to apply to our program. And we do offer rolling admissions. We start a cohort every 3 months. So we just started one July 6th. We'll start another one October 5th, and then again on January 5th. So, and then it keeps going, right, Elise?
Keeps going.
Always. So it's a quick year. It's a busy year, but I will say that a lot of our student feedback have said that the fact that it is a year means that there's this light at the end of the tunnel. So it's a doctorate degree, it's a lot of hard work, but then they know they're going to be done in a year. So, all right. Dr. Watkins, can you tell us a little bit about what it's like to be a student in the DMSC? Like, what are the courses like? Do I have to show up on a Tuesday night? at 8 p.m. on my Zoom session. What's it like? Tell me.
So that is a great question. This is completely asynchronous, which means we don't have expectations that you log in at a certain time to meet with your virtual classroom. And the reason is we have students literally from all over the world. We have a lot of military PAs who are scattered. We also have had some international PAs. So a few from Canada, a few from the UK. And we can't expect people to wake up at 2 a.m. to get on a virtual call. So this is all asynchronous. That means that on Monday, your coursework opens up that week, and you have until Wednesday to do an initial post based upon all the materials that have been given to you. And then you have another couple of days to respond to at least 2 of your peers. And we lay out exactly what the expectations are. There's a rubric, so it's very easy to understand. Essentially, it's as if you were creating a dialogue with your classmates, but it's virtually on this discussion board. And you have to have references, so it's not just a forum where you just spout out, vitriol. It's really very structured and academically oriented. And the idea really is to engage in conversation with your peers. So that's the discussion board. And then we do, generally, each class has 2 major assignments. Those tend to be either large papers, or in my class, I do a paper and a PowerPoint presentation. And the PowerPoint presentation is kind of fun, at least I think it is, and the students seem to like it as well. And then sometimes we'll do some interactive modules. So in my class, I do have some, they're kind of elementary, but there's some video games to demonstrate some of the concepts, for example, about how an epidemic or a pandemic can occur, about herd immunity. So, it's kind of fun like that. On average, a lot of people say, well, how much time is this going to take me? It really depends on how much time you want to put into it. About 6 to 10 hours a week for each 3 credit course. And that's kind of, the minimum expectation. Again, we know as faculty, the students who are not putting in the work. We know when they're going in there and they're just doing a 2-sentence response to peers, but their grades are going to reflect that. So this is not that you just show up and write a couple of sentences and you get your degree at the end. There's actually some academic rigor to the process. The other thing I do want to mention is that there's what we call a didactic component and a clinical component. The difference is when you're in PA school, you had your didactic first for the most part, and then you had your clinical or your supervised clinical experiences in the second part. This is kind of all combined. So in every term, you have at least one didactic course that you're taking, but then you're also doing your clinical practicum or your administrative practicum. Like Mrs. Hart said, it really depends on your area where you're working. So if you are strictly in administration, then your practicum will consist of interactive things that you'll do that relate to your job. If you're working clinically, depending on what area of medicine, you get to create these benchmarks, and it's really actually very cool. And so at the end of the year, you can have a portfolio where you could go to your collaborating physician or your hospital administrator and say, I just finished the DMSC, and look at all these thoracotomies I've done over the past year. I should be getting more money, which brings me to my next point. There are quite a few of our graduates who, when they have finished the program, have gotten a pay raise, because that's always questionable. What is this going to do for me? So that does happen.
Absolutely. And I've even seen a lot of students who are going for a dream job that they've been pursuing for a year, and they start the DMSC. And that is the determining factor. I mean, I can think of about 5 students off the top of my head who have told us that.
You're right. So I didn't even think about that. So we actually had a recent grad who is working with a pharmaceutical company, and she's a medical science liaison. So she's not a sales rep. She's a medical science liaison. And she has told us that she would have never had this position offered to her if she'd never been MSc.
Yeah, agreed.
Yeah, absolutely. So it does open up lots of other possibilities for other jobs.
Very cool. The other thing that I've heard is with these discussion boards, and you've probably seen it more than I have, Dr. Watkins, but I hear students say all the time is that through their coursework, they're making all these amazing connections with PAs across the country. And like, how would they ever, how could a PA in Arizona ever connect with a PA in North Carolina or South Carolina? And yet they're in the same class together. They're given the same prompts. They're interacting and sharpening each other through these discussions as they interact throughout the coursework. And I've heard a lot of students say that that's one of the best things about the course for them, is that like in a medical setting, they don't get a lot of chance to interact necessarily with other PAs. And yet in the DMSC, there's this whole community of PAs where they're like, you get to really, really encourage each other in their practice. So
I would completely agree. And, when I did my DHS, it wasn't just for PAs. So I had classes with nurses and occupational therapists and speech language pathologists. And there were lots of weeks when I would look at their posts and think, I know we're all about team-based care, but I really don't care that much about what you have to say from your orientation. I want to hear from, people in my profession. So absolutely. And then I will let you guys know too, that one of the best stories is that there were two gentlemen in different parts of the country who met in their first term in this program and just kind of hit it off, became really good friends. And then one of them flew out and was stood up for his wedding. He wasn't his best man, but he was at least one of the groomsmen in his wedding.
I didn't know the story. That's
yeah.
That is so cool. That's
kind of
really
cool. Mm-hmm.
Very, very cool. So we do have a question, and I'm going to go ahead and take it now because it's a great question. Are there exams?
Oh, good question. So in my courses, I do not do exams.
Mm-hmm.
I think that in some of the courses there's quizzes, but it's not like in PA school where it's where you have to do a certain exam soft or a certain kind of exam software that you log into, and it's controlled and you can't. That's not the idea, because honestly. Yeah, because we know that you guys know how to take tests because you're certified PAs, you've gotten through PA school. So so that doesn't happen.
Yeah, there are no exams. If there are quizzes, it's just like a reading quiz to like watch a video and take a really quick quiz to show that you watched the video, and then the assignment opens up. So yeah, for sure. The discussion boards and then the assignments that you covered are the main. Okay, well, because we are all PAs and by PAs and for PAs, one of the things that I'm super proud about is that we have just applied for and have gotten approved that all of the courses that we offer have CME. So this is a wonderful update. Most of our courses, there is one course that actually has more, but most of them have 10 credit hours of Category 1 NCCPA. I said NCAPA earlier, but it's NCCPA approved Category 1. And that is also true for the certificate courses. So if you're here and you take the certificate course, you go through those 3 courses, you can get up to 30 hours. If you're going through the full DMSC, you can get up to 100, which is phenomenal. And I cannot speak for employers and how employers use CME funds, but we have had several students be able to apply their CME funding from their job to this program. But that is definitely something to check out with your employer. All right, Dr. Watkins, here is the moment for you to show us your global health chops. Talk us through the certificate and the different courses that are involved in it.
Absolutely. So PA 940, Global Health Issues, is one of our core courses that all the clinical students will take. But it became very evident, particularly with COVID, that we needed a little more. So I developed these other courses for the certificate. One of them is Clinical Issues in Infectious Disease. And I thought of that one because in global health, in that PA 940 course, we do talk a lot about these different diseases, but it's really more from a macro perspective. So 941 is more of a micro. So you really look at patient presentation. How would you assess a patient who had a certain presentation? What labs would you order for all these weird kind of tropical diseases that you kind of started to learn about in PA 940? And then 942 is more of maybe softer, I want to say, but we really delve into health disparities, health inequities, and all those areas that we just, especially again with COVID, we can't ignore. So that really goes into that. The cool thing with 942 is that you don't have to have a social science background. This is very, very basic, introductory. But if you have a master's in psychology, that's great too. Then you're gonna be like, oh, this is right up my alley. But this is going to talk a lot about some of the psychological, some of the social, some of the anthropological issues that surround healthcare, because we all know you can't take care of patients. We don't live in silos. I mean, we're a part of a culture, we're a part of an entire planet. So that's the Global Health Certificate.
And let me just interrupt that Dr. Watkins has an anthropology degree. And so like whenever we get to talk, it is so fascinating because it is so holistic. And you think about the world and care, and just that you really think from every angle. You see people as whole people. And I've always loved that about you. And I'm not even a PA.
Well, you are a PA by proxy.
Oh, okay, well, it would not be an evening talking about a doctorate degree without the little pop quiz. So, Dr. Watkins, can you give our info session tonight a pop quiz?
Yes. So, a 24-year-old female presents to your remote clinic early one morning while you're still setting up and getting ready for the first day of your humanitarian medical mission. Her chief complaint is leg pain. What is your diagnosis?
All right, so there should be a poll for you on that left-hand side. So take a guess, and don't be shy. We know we haven't gone through the global health course yet, but Dr. Watkins, tell us, what is the answer?
Did everyone answer it?
I don't know. I have a teammate that's manning the slides. I do see some answers. So yeah, there are some coming in.
All right, come on, because you guys, I can't see you. So it's not like I'm going to look at your answer and think, oh, that person got it wrong, so we're not going to admit them.
Before you answer, I tell you what, to give people a little bit of extra time. So today is a special holiday, right, for global health?
It is. And I don't know if you guys know, but today is World Mosquito Day. Yay! We know about World Chocolate Day and World Coffee Day. Today's actually World Mosquito Day. And so the World Health Organization and CDC like to use this day and disseminate information about the danger of mosquitoes, because most of the diseases we see in a global health context, aside from the chronic diseases, are due to mosquitoes. So they're nasty little buggers.
All right, so what's the answer to this quiz? I have no idea.
So it's lymphatic filariasis or elephantiasis. And so this was a patient who I saw when I was in Nicaragua in 2019. And that's the other thing, y'all, is that a lot of times, although with COVID, we're not sure what's going to happen, but we take the PA students, the master students internationally on their trips. And this would potentially be open to doctoral students as well. So it's really fun. So yeah, lymphatic filariasis.
Awesome. So Tyson did put a link in our chat if you do want to learn more about Global Mosquito Day. So super fascinating. So before we wrap up and go to Q&A for the evening, I do want to just go over some more just baseline practical information. The certificate and the DMSC actually have the same credit per credit hour cost. So you can see the breakdown there. The certificate is 3 courses, the 3 courses that Dr. Watkins went over. And our tuition right now is $677 per credit hour. And there is a small tech fee and a small program fee associated for each term. So you can see those there. And this is the breakdown for the full DMSC. So if you want to see, we do have on our website laid out the credit hours, the 7, 11, 8, 11, what courses you would be taking each term. That is laid out on our website. But you can get an idea for the cost. And in the DMSC, our students are eligible for financial aid, and many of them do. Many of them also use their employer funds to help cover the cost. And then we also have a lot of students who are military or are able to use their VA benefits. And we have a wonderful veterans coordinator who works with our students, and really, we are a yellow ribbon school, and we're really proud of our military population, and we go out of our way to take care of them and get them all the benefits that they deserve. So if you are interested and you are ready to take a next step, what I would say is go ahead and go on our website. You can apply. Once you're put in all your documentation, the application will lead you step by step for the information we need. Once we receive your documentation, your transcripts, your letter of recommendation, then we will review the application. Once you're accepted, there is a $300 deposit to be able to enter into courses, but that goes toward your tuition. It's just a prepayment of tuition, so that way you can we know that you're coming and that you want to start our program.